my greatest pleasure on the eve of World Heart Day to be here with you at this outstanding and tremendous futuristic conference. What can we say when the world says there are so many problems? What we can say is that the world offers and the human mind offers so many solutions. And that's just it. So that's what we're here today to imagine together, to co-create together the world that Chairman looks forward to, where he said very simply, how can we prevent preventable deaths? And that's just it. It's one single line, but it's so powerful, it's so meaningful. And that's what we're here to talk about. I think we shared in the very beginning the cardiac command station and the fact that we can connect remote areas, this telemedicine that we've been working for the last 20 years, the fact that we can now use technology to connect, whether it's the ECG today, the echo tomorrow, the cath lab immediately after that, we will be a connected cardiac care environment. You have witnessed, ladies and gentlemen, the beginning. Today across India, 250 points are connected. Believe me, in the next 30 days, this will more than double. And in the next 90 days, this will double again. You will see a linear growth in the capability of doing cardiac ECG transmission. But this is not about the technology. This is about the linear growth of hearts, lives saved. So that was trans-telephonic ECG. Then we said that it's the technology and the electrical signals connecting our heart and connecting our minds is fabulous. But what about the chemistry? And that's where Abbott came in and said, let's talk chemistry. Because each one of us know one individual who's slim, whose cholesterol is under control, who doesn't have diabetes, and yet he had a heart problem. And now we're saying that there's something more, and that's the whole biomarker space. So we go into the environment of how do we analyze the biology, the genes, and look at that more significantly. This is the beginning of yet another very important journey. And then we went one step further with Microsoft, which is a very important initiative that we've been working on for the last 2 years, which thankfully today has not just become global, but has got global recognition, because just 4 days ago in San Francisco at the TCT conference, all of you know, you cardiologists think that's one of the summits or the mecca of your cardiac scientific area. Apollo Hospitals, one of the cardiologists, Dr. Shivakumar, won the best, most innovative, futuristic paper presentation when he presented the Apollo Microsoft Cardiac Risk Score. And so you've seen that as well. And this is just going to say, so we're doing these small steps, but it's 1.3 billion people, it's 7 billion people in the world. It's India with a higher cardiac incidence of cardiac disease than your Caucasian counterparts. How do we have the guts and the courage to say what we say? It's because we've done what we've done over the last 36 years, and that we is all of you. So actually, ladies and gentlemen, I'm so privileged to just pick out and ask a few people in the audience who are the real heroes of cardiology. The real heroes of cardiothoracic surgery are sitting here in the audience. And I'm going to be asking them just a few questions, because it is these people, it is these heroes who have completed over 155,000, so 1.5 lakh, more than 1.5 lakh heart surgeries over the last 36 years, with a 99.3% success rate, on par with any of the best centers in the world, the very best, at 1/10 of global prices. It is these people who have done that. It is over 500,000 cardiac interventions, over 5 lakh angioplasties. And we went from angioplasty in the very beginning. I was in Apollo Chennai working at that time when we did our first angioplasty. From angioplasty to rotablator to to drug-eluting stents to using all kinds of other methodology to improve the outcomes. This journey has been a 36 years tremendous journey of 500,000 interventions. Don't think of it as cath lab procedures. Think of it as 500,000 people who have gone home happy, gone back to their families. And that is the beauty of that program. And I cannot even count the number of people who came into emergency with an MI And by God's grace and tremendous work of our emergency teams, we've been able to save them. So let's start talking to these people. So let me start. Dr. Sridhar Felix, Dr. Girinath, who was supposed to be here, is in surgery, and Dr. Sridhar Felix, who represents the team. On our 25th anniversary, I was in an audience, something like this, and then we said, Dr. Girinath, you've done over 35,000 heart surgery to yourself. Now he's done over 55,000 personally. You've done this. How do you feel? And you know what Dr. Girinath said? And he looked at Dr. Reddy and said, Dr. Reddy, thank you. Because while I'm happy that we've done so many surgeries, I am thrilled that of the 147 credible heart surgery programs in this country, Apollo has trained people in 90 of them have people who have been trained at Apollo. So it's not just what we directly do. It's not what we directly do, it's the impact we have on the healthcare of the country. So we will train, we will share, our registries will be open for everybody to be part of. Our GenWorks will be a training program. Our Microsoft Risk Prediction Score will be a global score of pooling of data. Everything that we know in the pursuit of science will be shared with the medical community to impact and touch more lives. But I definitely do want to acknowledge the tremendous work that you do, the hope we have in the future. And the fact is that by this combination of tremendous, talented, committed team, we can treat and cure. By this combination of science and technology, we can predict and prevent. And by the combination of the biology and the innovations that we can do internally, the stem cell, the biomarkers, we can go even further. Because if you look at the Abbott study, you saw less than 10% of people were in that high risk. But how do you find those? We will use science and technology to take this 1.3 billion people and screen and categorize, to focus on those at high risk so that we can predict and then prevent. That is the future to overcome. So we come back to exactly what Chairman said, that we must prevent, we must ensure that there is no individual who dies of a preventable condition. That is the fight against NCDs. That is our commitment on the eve of World Heart Day. Apollo is committed. We are together. We will leave no stone unturned to use science and technology and the human will and the power to overcome heart disease and to find a way to do that together. So thank you all so much. Let's do it together.